You are listening to the Health Highlights Podcast, sponsored by publiclytradedpodcast.com. Health Highlights is dedicated to shining a spotlight on companies in the medical and healthcare-related industries. From new therapies to durable equipment manufacturers, pharmaceutical, nutraceutical, and bioscience drug discovery and development, to precision surgical tools. We highlight publicly traded companies that are helping to create a healthier future. And now, your host, Marcus Heatherly.
On today's episode of Health Highlights, we're excited to spotlight a new company, Progressive Care Inc. They're trading on the OTCQB under the ticker symbol RXMD. Progressive Care Inc., through its Pharmco subsidiaries, is a South Florida-based health services organization and technology company. They provide services like prescription pharmaceuticals, medication therapy management, and more. And with us today, we're excited to have her, is Miss Shital Mars. Miss Mars, welcome to the show.
Thank you so much for having me.
If you would, please give myself and my listeners a little bit of a background about you and your company, Progressive Care Inc.
So I worked in financial services through investment banking, and I have been affiliated or associated with Pharmco and Progressive Care for the better part of 11 years. I've known the owner, or the prior owner before it went public, for 11 years. They opened for business 2 days from now in 2007, so the company's been around for a long time.
Mm-hmm.
And I moved to being a full-time employee as the Chief Operating Officer in 2012. So I've been here working the day-to-day, doing all of the executive management for the last 7 years, and I've been the CEO since 2016. And what we've really focused on is turning this company into a solidly healthcare-driven enterprise that focuses on the future, that focuses on technology, that focuses on innovation and patient care. And I think that's shown, and that's why we've been so successful over the last 3-4 years that I've been at the helm.
Well, I've been following your company really since around the time you became CEO, and you guys have been growing rapidly in the past year. Recently, back on May 21st of this year, you guys released news about your record-breaking sales in April. What would you say fueled that dynamic growth?
So what comes out every year are what's called HEDIS scores. So a lot of doctors get these performance ratings that tell them how well they're performing in the plan in managing their patients' healthcare outcomes. And 40% of that performance score is tied to the performance of the pharmacy. So if a patient goes to the doctor and then never fills their prescription for a chronic care condition like diabetes, that doctor is going to underperform because the pharmacy is not filling those prescriptions.
Mm-hmm.
So when these scores come out, they start recognizing that they have improvement that they need to make. And a lot of that improvement centers on pharmaceutical care. And so they begin to look for the best pharmacies in their area, the best pharmacies that are out there. And I say this a lot, and it doesn't really resonate because a lot of people are not in this business. But when I say we're a 5-star pharmacy, it's just not an accolade. It's not a plaque on the wall. What that means is we are proactive in working with the patient.
Mm-hmm.
We get all of their meds. We organize all of their meds. We make sure they're not on duplicate therapies. We make sure that they're not on medications that could be counterproductive or interact with another medication that they're on. We try to make it as streamlined as possible, eliminate all the obstacles to care, go talk to the insurance carrier and coordinate everything. And when doctors learn about this and when patients learn that they can get unit dose packaging, that they can get free same-day delivery, that they can get someone who knows their name and understands the world that they live in and the healthcare language that they speak, switching to us is a no-brainer. And so we are constantly getting new prescriptions, we're constantly getting new patients, and we're constantly onboarding new physicians who are looking for this level of care because it makes a difference for their practice and it makes a difference for their patients. So that's really what's fueled a lot of this growth.
That's exciting, Shital, that you recognize that it's not just one thing or one facet, but that you know that providing excellent service and customer care is going to produce not only repeat business, but new business, which works in almost every business model. Shital, Progressive Care Inc. has been diligently working on acquisitions in Florida. If you would please give us more details on the news from June 4th about the acquisition of Family Physicians RX.
So we have a number of accomplishments that have occurred over the last 3 years. The acquisition of Family Physicians RX is our biggest one. It's the one I'm the most proud of. It's something we had been preparing for many years. What it did for us is allowed us to double in size, effectively double in size. They do about 18,000 prescriptions a month, so that brings us as a combined entity to close to 50,000 prescriptions a month out of all of our stores. And they do $1.4 million a month in net revenue, so that brings us close to about $3 million a month in revenue. And that took us from 2 locations to 4. It brought us from South Florida now to Orlando, into the I-4 corridor. Yep. And for those listeners who don't know Florida geography very well, the I-4 corridor is where the villages are. It's where a high senior population is. It's very diverse. It's very urban. You can go west, and you're going to Tampa, St. Pete, those towns, and you're going east to Daytona. So there's a huge population base. And this base of people are really looking for the services we provide. South Florida is a little bit ahead of the curve in going the direction of performance-based metrics. As you move further north into the rest of Florida, they don't have that. So when we come to them and say, we can do unit dose packaging, we can do medication therapy management, we can do adherence training, we can do medication coaching, we can do telepharmacy, which we have spearheaded. These are things they've never heard of before, and these are all things that they want. These are what clinics want, this is what patients want, and we can be that first-to-market pharmacy and expand on what Family Physicians has already built and create something even bigger. So we have 4 physical locations on top of Progressive Care, on top of the building that we have. So we have this great base to launch from, to go to the next stratosphere of revenue and sales and patient awareness and market share.
The company that we're highlighting today, Progressive Care Inc., they trade on the OTCQB under the ticker symbol RXMD. With us today is the CEO, Shital Mars, and she has a background in financial services. Take a look at RXMD if you haven't already. They're a growing company. Building on your momentum from April, again, you guys had steady sales into May. How do you see the rest of the summer shaping up and then going into the final quarter of this year, 2019?
Summer is essentially our slowest part of the year.
Yes.
So the fact that we're doing as well as we're doing is a testament to how far we've gone and how much growth we've had and how much our reputation precedes us in our interactions, that we have this great uptick in sales, and we're continuing that year-over-year growth trend. Once it gets into August, that's when things really start to ramp up for us. August through December is pedal to the metal, go, go, go. We get a lot of new patients and a lot of new clinics after clinics get scores in August, September. So the last quarter of the year should accelerate the growth, and we should see these trends of year-over-year growth continuing into the end of the year. We're hoping to hit all of our goals by the end of the year, but we have a lot to do to get there. We have to integrate FPRX, the Family Physicians RX, and we have to accelerate their growth as well. We should see both companies, both entities under the Progressive Care umbrella, experience an acceleration of added patients, added prescriptions going into the end of the year, which is great for us, and we're anticipating that. But as we know with healthcare, there's always challenges. The good thing for us is we kind of anticipate challenges before they come. We don't wait for the contracts to change on us and be surprised. We know that that the PBM world is hairy. We know that the insurance carrier world is difficult.
Yes.
So we plan ahead for all that. We know that reimbursements go down. We know that there's contraction and benefits restriction. So we go ahead and we market ourselves on the things that are our core competencies. On top of, we're trying to very hard to branch out into business-to-business sales, into direct-to-consumer sales, into retail sales. That will allow us to diversify our revenue stream outside of just the insurance model and be able to service these patients in a healthcare arena that they need. We know that a lot of businesses are struggling with compliance and accounting and healthcare reconciliation, and we know that better than anybody. So we're going to be marketing that and our 340B services and our MTMs and all of that to gain traction going into 2020 with a whole new line of business.
Folks, if you haven't heard of Progressive Care Inc., take a look at them. They're on the OTCQB under the ticker symbol RXMD. They've been around for a long time. If you're looking for a great long-term play in healthcare-related services and pharmaceuticals, look at RXMD. I think you'll be pleased. They're very well managed, as you can hear listening to Miss Mars. Before we go, is there anything that we didn't get to talk about today that you'd like our Health Highlights listeners and your investors to know about?
I think that with Health Highlights, we want to talk about the main point, which is if you're going to invest in healthcare, you want to invest in a company that's actually delivering results. At the end of the day, I can make all the money in the world, but if I'm not actually helping people, what good is it? So when you're investing in Progressive Care, you're investing in a company that is servicing 20,000 patients, is delivering 90 to 95% adherence rates, which the average in America is 50% adherence. That means half of the people in America are non-adherent with their medications. And so for PharmCo and our facilities, 94% of our patients are adherent. That's unheard of. We are in the top 6th percentile of all pharmacies in the nation with Humana and other insurance carriers. So you're investing in a company that's real. You're investing in a company that matters and is making a difference. And you're also investing in a company that's growing, that's changing this field, that's changing what it means to be a pharmacy. Last year we started TelePharmCo. We were working on the app. We were developing it. We were pitching it. And now you go to the conferences, and now telepharmacy is a big word. We're the ones that created that. So we're innovating in the space. We're creating new efficiencies. And we're navigating a very convoluted space in a very efficient way.
Indeed.
So a lot of pharmacies, lag behind us in the amount of inventory they carry, in the number of people it takes to fill a prescription. We're constantly at the low end. We run lean. We don't have excess staff that we don't need. But at the same time, we're also hiring, and we're one of those big job creators. We have 125 employees now. And, 2 years ago or 3 years ago, we were at 40.
Yep.
So in just a few years, we're 3 times the size we were and getting better every day. So for investors, I hope that they look at the fundamentals and know that we're investing for the long term, and we're creating something that's going to change the way pharmacies work now and into the future.
Shital, I really appreciate you coming on today and giving my listeners an update about what's going on with your company. We hope that you come back again in the fall. I know you'll have great news then. Folks, take a look at them. Progressive Care Inc. They're on the OTCQB under the ticker symbol RXMD. Ms. Mars, thank you again for your time.
Thank you so much.
This audio interview was entirely sponsored and produced by Publicly Traded Podcasts, which is responsible for the content. The opinions and information provided in this audio interview are those of the guests and those of the respective companies that they represent, and do not necessarily reflect those of the team or management of Publicly Traded Podcasts. All listeners of this audio interview are encouraged to do their due diligence and research when planning and executing investment strategies. We strongly recommend seeking the assistance of an investment professional. The guests interviewed may have paid for an extended audio distribution package and are in no way affiliated with Publicly Traded Podcasts or their audio distribution partners.